Okay, it's a sight that'll make any parent's heart skip a beat. Your child comes home from school and their cheeks are so bright red, it looks like they've literally been slapped. It's pretty alarming, right? But in most cases, it's actually a sign of a very common and, surprisingly mild illness. So, what's really going on behind that fiery rash? Let's get into it. Yeah, this is the big question every parent asks themselves. That intense red rash is the classic telltale sign of a super common childhood illness. And in the next few minutes, we're going to break down exactly what it is, how it spreads, and most importantly, what you really need to do about it. All right, first things first, let's solve this slapped cheek mystery. We'll look at the official name for this thing and uncover the tiny little virus that's responsible for all the drama. So, at its core, this is a viral infection. And while everyone knows it as slapped cheek disease, you might also hear doctors call it fifth disease, or if they're feeling fancy, erythema infectiosum, which is really just a technical way of saying infectious redness. Bottom line, they all mean the exact same thing. Now, the virus causing all this is called human parvovirus B19. And I know what you're probably thinking. Parvovirus, isn't that a really serious thing that dogs get? It's a super common mix-up, but listen, the human version is completely different from the one that affects pets. You cannot pass this to your dog or cat, and you absolutely cannot catch their version of parvo. They are two totally separate viruses.
Okay, so we know it's a virus. The next logical question is, how does it get around? Especially in places like schools and daycares, where it seems to spread like wildfire. Let's break down how it's transmitted.
Well, no big surprises here. It spreads just like your average common cold. It travels through the air in little droplets from coughs and sneezes, or you can get it from direct contact with things like shared toys. And that right there explains why we so often see these outbreaks pop up in places where kids are all crammed together, like classrooms and daycare centers. Okay, I need you to pay close attention to this timeline because this is the most misunderstood part of this entire illness. So after someone is exposed, there's this long incubation period. We're talking up to 21 days. Then, before any rash shows up, they might get some mild flu-like symptoms. Now look at that pre-rash stage. This is when they are highly, highly contagious. And here's the kicker, the key takeaway. By the time that famous red rash finally appears on their cheeks, they are actually no longer infectious at all. So we know how it spreads, but what does it actually look and feel like for the person who has it, beyond just those bright red cheeks? Of course, the bright red cheeks are the main event. That's the headliner. But as you can see, the person might also just feel generally blah, a runny nose, some aches, maybe some stomach pains. And a mild fever only happens in about a third of people. Oh, and take a look at that last point about joint pain. While kids don't usually get it, it's a really common and pretty miserable symptom for adults who catch this virus. So that rash on the face, it usually only lasts for about 2 or 3 days. After that, you might see a different kind of lacy-looking pink rash pop up on their arms, legs, and even their chest and back. But the tricky part is that this body rash can come and go, reappearing on and off for several weeks. And that brings us to a really important point for parents. If you see that rash suddenly reappear after a hot bath or on a sunny or windy day, please don't panic. This is a completely normal part of the illness. It's not a sign that they're getting sick again. It's just what the virus does. Okay, now we need to talk about the risks. For most people, this is a pretty mild illness, but for a few specific groups, it's a totally different story. But let's start with the reassurance, because this is important. For the vast, vast majority of healthy kids, slapped cheek disease is exactly what it looks like, a mild flu-like bug that their body will fight off without any serious problems. So if it's generally pretty mild for most children, who are the people who really need to be careful? Well, there are 3 specific groups that need to pay close attention. First up, adults. If an adult who isn't already immune happens to catch this, they tend to have a much tougher time than kids do. The illness can be way more severe, with a really intense, widespread rash, and like we mentioned, the main feature is often a nasty case of arthritis-like joint pain. The second high-risk group is pregnant women who haven't had the virus before. Now, the risk isn't really to the mother, but to her developing fetus. While it's very rare, an infection during pregnancy can cause complications. It's really important to know, though, that there's no evidence it causes birth defects. The clear takeaway here is this. If you're pregnant and you think you've been exposed, the absolute most important thing to do is call your doctor right away for advice and a blood test. And finally, we have people with certain pre-existing conditions.
This includes kids with blood disorders, like sickle cell anemia, or really anyone with a weakened immune system, maybe from leukemia or chemotherapy. For these individuals, the virus can cause very serious problems. The guidance is crystal clear. They should actively avoid any and all contact with anyone known to have the infection.
All right, let's finish up with the practical stuff. How do you actually manage this at home? And what's the official advice?
Because this is a virus, antibiotics are totally useless. Treatment is all about managing the symptoms to keep them comfortable. The plan is pretty straightforward. Step 1, keep them hydrated. Push plenty of fluids. Step 2, you can use paracetamol for any fever or aches and pains. Step 3, if that rash gets itchy, a soothing lotion like Calamine can be a real lifesaver. And finally, since sunlight can sometimes make the rash flare up, a hat is a great idea if they're playing outside.
And here it is, the final, crucial piece of advice every parent needs to hear. Remember that timeline we talked about? Because the infectious period is over by the time the rash shows up, there is absolutely no need to keep your child home from school or daycare. As long as they're feeling well enough to be there, they are good to go. So after everything we've covered, I want to leave you with one last really surprising statistic. And it's this number, 6 out of 10. What do you think that could possibly refer to in the world of slap-cheek disease?
It turns out that a whopping 6 out of 10 adults have already been infected with parvovirus B19 and are now totally immune, and most of them never even knew they had it in the first place. It just goes to show you how common and often how incredibly mild this virus can be. So while that bright red rash is definitely alarming to see, for most it's just a harmless little sign of a classic childhood illness passing through.